Been with SOMOS since the beginning, one of the founders, and we're responsible for 2,500 providers and approximately over 1 million patients. And within SOMOS, my responsibility is the technology, cybersecurity, engineering, data development, et cetera. I'm more of a behind-the-scenes guy, and it's hate to be in the spotlight. I think it's a well-known fact that IT folks turn to dust in the spotlight, so you'll have to excuse me. But I am very excited to be here, talking healthcare, listening to you talk about healthcare, and then very excited to be part of this panel, with folks who share passion with IT. There's a great story by Justine Musk, and I'm paraphrasing. She's an author, and she's the ex-wife of Elon Musk. Again, I'm paraphrasing, but she says, do one thing and master it, and then do another thing and master that, and then combine it together and see what magic happens. So at SOMOS, what we try to do is, I'd like to think we're developing our mastery in technology, and we certainly know how to communicate with our physicians and our patients, right? We're very strong culturally, and very strong cultural competency there. And then if you bring that together, and Alan, I'm kind of echoing what you say about implementing technology for implementation's sake, that doesn't happen without knowing what the end user is going to need, right? So bring that together and see what magic will happen with how we plan to kind of engage our patients, engage our physician, be able to meet the metrics right at the end of the day. But looking at definitions and what Dr. McDonald presented earlier about equity and value-based care and social care, of course, that's a lot of stuff that SOMOS is doing already, right? I mean, I think Dr. Talaj flashed a couple of metrics on the board or on the TV screen earlier, and I think we're in a good position, right? Our experience puts us in a good position to be able to see success and share some of that success with some of the initiatives that the state's putting forth. Certainly I've had the privilege of working with Jim during district days and looking forward to collaborating under this waiver. But there's so many examples of high utilization in the ER, high utilization in inpatient settings. And the reasons, right, and oftentimes in today's environment, it's really the symptom that's treated and not necessarily the cause. And a lot of these causes oftentimes are, housing related, and they are nutrition related, right? They're substance use related, and I'm excited to see what how this waiver can kind of address some of those. We've certainly had a lot of lessons learned from DISRIP, from capacity building to calibrating technology to see where response is the highest, hint its incentives. To centralization and systemization of services and data. The Yankees and the Mets, that's a bad example, they've got a bigger budget than me. If sports teams can use data and win, there's no reason why healthcare can't do that. And in SOMOS' context, it's the easy stuff. It's duplication of services, it's missing services, it's non-users. Like, how do we address some of these problems that we're seeing at the clinics that we're partnered with? Repeat use, we see all the time repeat use of ER and admissions just because it could be an access to care issue, et cetera. But then regarding technologies, you have to insert the right technology, right? That don't necessarily know what that means. Like in any setting, it's not a one-size-fits-all at all. But one lesson learned that we did have, and we definitely learned this the hard way, is if we're not in the workflow of the physicians or the CBOs or the hospitals that we work with, it's not going to get done. And I think we've been able to do that with our physicians. The waiver, we're going to be starting to work with a lot of CBOs now. So kind of taking those lessons learned, and if we're not in the workflow of the CBOs, it's not going to get done. Some of the challenges, right, connectivity and accessibility. This is really the main source of technology for a lot of our patients. So if there's no broadband, if there's no connectivity with cell phones, and even, it's not necessarily just like being able to connect, but if it's not intuitive, you're gonna struggle a little bit with that too. Technology itself is one part of the equation, right? There's training, there's monitoring, there's behavior correction if they're using it wrong or incorrectly. One of my favorite restaurants is on 28th and Lex, Saravana Bhavan. It's an Indian restaurant, and they've got locations all over the world. Netherlands, Southeast Asia, Dubai. The original one is in India, and it's actually in Chennai. And what they have there in that location is they have a dashboard. And if a transaction happens in New York, they see it in India. And I'm not saying this to be like big brother-ish about technology and looking at what folks are or how folks are using the system, but it's an opportunity for behavior changes, or it's an opportunity to say, hey, we have this technology to be able to help you do this better. Why are you reverting back to what you were doing previously? That sounds a lot tougher, or actually it's actually a lot tougher than it sounds. But I think with the right alignment, and again, I was speaking with Jim earlier about aligning with standards, but with the right alignment, I think SOMOS' reach can just be a little bit better. And then one more thing during the pandemic regarding technology. During the pandemic, SOMOS was able to stand up an EHR Lite type of system, where we did appointment setting and we did vaccine lot number tracking. That was important at the time. One of my colleagues and great partner who helped me is actually sitting right there in that table, MD Land. Thank you, James. But we developed that in days, right? We had our own Operation Warp Speed going on at SOMOS. But the next day or a couple days later, I'm reading in the New York Times that people were using Eventbrite to schedule appointments. Other agencies and other places around the world or around the country. And kind of proud to also share that we did help and advise the state design their own vaccination platform. But little wins like that in technology, I think and it was used well, and was able to get the data from point A to point B, and eventually to the regulators who needed it. I think that's some of the successes and some of the experience that SOMOS has to be able to